joining me now to discuss World Diabetes Day 2025 as we take a look at causes, prevalence and management of the disease is Professor Felicia Anumah. She's the Director, Center for Diabetes Studies, University of Abuja. Thank you so much for being here.
Thank you for inviting me.
So it's World Diabetes Day. First, let's start with the figures because Olije was reporting 3 million and we both had a chart behind the camera to say that's quite low because, I mean, the Diabetes Association of Nigeria is even calling for the federal government to declare a state of emergency. So what's the prevalence? What are we dealing with? The numbers as it stands today?
As at 2018, the prevalence that we had was 5.77. That's about 11 million Nigerians with diabetes. But I can tell you that it is much, even that is an underreporting. But luckily, the Federal Ministry of Health, in collaboration with the World Diabetes, WHO, and Global Fund, we've carried out a national survey on non-communicable diseases, including diabetes. So I believe that the study is being analyzed now, a report is being written. So I believe we're going to have, you know, at least something close to what exactly it is. And I can assure you it's going to shock Nigerians.
So it's definitely not 3 million.
Oh, definitely.
It's way more than that.
Definitely.
Okay, so while we don't have the accurate figures, we are certain that it is more than 3 million. But there's another challenge, which Olije highlighted, is the diagnosis of it, that, you know, majority of these are undiagnosed. So my question then is, why is diabetes with such a high burden not diagnosed properly or early enough in Nigeria? Where's the gap? What's the problem?
Well, the problem is diabetes is such a complex disease that it can be silent until the onset of complications. So people have going around their business, but blood sugar is high because they are not feeling pain here and there. They think that they are okay, they are normal, but it's causing quiet damages inside until people present with kidney failure, with strokes, with, you know, gangrene, and we have to amputate. There are people that present for the first time with some of those chronic complications, and that goes to emphasize the importance of checking, you know, doing medical checkups. In fact, what the Federal Ministry of Health is advocating is that any opportunity for anybody to get to a hospital for whatever reason, blood sugar should be checked.
Beyond the blood pressure,
and of course,
to check
the blood sugar.
Blood sugar. Okay. What about lifestyle factors? We hear a lot that, you know, it's the way you live your life that determines whether you're going to have diabetes or not. Is that a myth or a fact? How much of Nigeria's diabetes burden is really about life factors, and how much of it is other issues? Okay.
Well, there are different types of diabetes, but 95% of the diabetes we are discussing is type 2 diabetes, and that's the one related to lifestyle, to how we live. So it's very important discussing the issue of, you know, life factors. And I think what is critical here is for people to know what the risk factors are, what makes them to, you know.
So what are they?
One is, the first is aging. As we age, there are metabolic changes in our body that will tilt the body naturally towards the disease side of the spectrum of life. And so blood sugar will rise with age. Naturally, blood pressure tends to rise with age. Even the cells tend to misbehave, to go out of order, and the issue of cancers will come. But if we don't want to go that natural way, we need to change behavior at some point. So aging is a risk factor. The next important risk factor is family history. If one parent has diabetes, any of the children of that one parent has a 40% chance of having diabetes. But I'm quick to say, if you have a 40% chance of having a disease, there's a 60% chance in your hand to get the information.
Of not having it.
Live right and not have it, but you need the information to be able to live right. Now, the next risk factor is overweight and obesity. I always say God is a perfect scientist. For every height, there is an ideal weight. When you allow your weight to get beyond what that height is meant to carry, that's the beginning of problem. That's the beginning of, you know, the lifestyle diseases, diabetes, hypertension, and so on. And how does weight come? It's simple economics. When our input is more than our expenditure, there is an imbalance that settles as fat. Okay, so weight on its own can bring diabetes without a family history. Weight on its own can bring hypertension without a family history. Weight can be the reason for some cancers that we experience. Okay, so if we and I usually tell people that, you know, we have simple ways of measuring where exactly we are. So I ask people, get your weight in kg, get your height in meters, and divide your weight by the square of your height.
Okay.
Somebody is 60 kg and maybe 1.5. 1.5 times 1.5, divide 60 kg by that, you get your BMI. So if BMI is more than 25, then there is work for that individual to do. Also, very importantly, I tell people to take the telos tip and measure your waist circumference. Okay. Okay. Put it around your navel. For males, if it is more than 40 inches, then they have accumulated something here that they need to get rid of.
There's no evidence of good living.
No, it's not. Okay. For females, if it is 35 inches, more than 35 inches, they have accumulated something here that they need to get rid of. It's not evidence of good living. In fact, the most sensitive indication that diabetes is coming, hypertension is coming, is the waist circumference. So, but in our environment, I'm quick to say, we have beliefs and cultures that are counterproductive to what we are discussing.
Let's talk about those beliefs and myths very quickly, because I also want to ask you about treatment. Okay. So, very quickly,
the thing is, you know, in our environment, when you have weight, you are respected. It means that you have arrived, things are beautiful, things are good for you. If you are a female and you are married, for example, and you are not adding weight, it's like the man is not, you know, able to take good care of you. So, and people love to be respected. So they would rather have that weight than, you know, being slim and you are disrespected. It is imagined that you are not anything. And also, you know, oil in some cultures is evidence of richness. Yeah. And so you find our foods...
it's part of the bridal list, isn't it?
It's part of the bridal list. So you find our foods heavily soaked in oil. And when we take so much oil in, of course, too much oil is a reason for weight gain. You know?
Are we talking about all oils here or just certain oils? I mean, in our climate, we are beginning to see more oils.
In our climate, I am going to say we use all oils sparingly.
So moderation is the key word.
Moderation is the key word.
All right. Other myths. I've seen people who are skinny and are diabetic. I've seen children with diabetes. So how does that work? Yeah, that's why I said earlier that we have different types of diabetes. The type 1 diabetes occurs more in children. Okay? And that is not really related to lifestyle, but that you can have that in children. But unfortunately, we are beginning to see type 2 diabetes in children because of overweight and obesity. Okay, so treatment, very quickly. Let's talk about treatment. And there are those who are calling for, like I said earlier, declaration of a state of emergency. I wonder what that would look like. And sugar-sweetened beverage taxes to discourage people from taking sugar beverages. Would that work? Will it move the needle?
It will. I am a member of actually the Coalition for Sugar Reduction in Nigeria, in beverages in Nigeria. Now, the thing is this, anything that is sweet in our mouth contains what we call refined sugars. These are sugars in their most easily absorbable form. They don't need any digestion process to run into the blood and step up the blood sugar. Now, this organ, famous organ in the abdomen, we call the pancreas, where this chemical comes from, that helps us to utilize everything we take as a source of energy and nutrition. When blood sugar is high, it's not meant to be up there. There's a normal range. So once that organ recognizes blood sugar is high, it has to push out this hormone, this chemical, to bring it down. Now, when you harass this organ for quite a while, a stage comes, it gets exhausted. And when it gets exhausted, there's no coming back. And so sugary things actually harass those organs because you are harassing it to push out this thing to bring down the blood glucose. Are you getting me? So that's why the sugar tax is so important, because it is going to reduce the amount of consumption of sugary things. And what we are saying is preserve this organ to see you to old age.
Okay, but that's not to say that everything bitter is also good for the body or will stop diabetes.
No.
I want to speak very quickly to that notion, because there are those who talk about, bitters, and there are so many source of bitters in the country now, and people say, oh, no, you have to take something bitter because of diabetes.
Well, it's not necessarily so that, okay, if you take all the bitter things, then it will treat diabetes or it will prevent diabetes. It's not necessarily
All right. Thank you so much, Professor Felicia Anumah, Director, Center for Diabetes Studies, University of Abuja, for being here and throwing light on the subject. Thank you.
Thank you very much.